Welcome, and thank you for joining us on The People Behind Your Water, where we spotlight water resources issues affecting us in Santa Clara County. My name is Teresa Alvarado, and I'm the manager of the Office of CEO Support and Communications at the Santa Clara Valley Water District. On November 30th, the Water District hosted a day-long workshop entitled Creating Sustainable Water Supplies with Recycled Water. In this episode of The People Behind Your Water, we'd like to feature one of the speakers from that event and bring you this informative presentation. The speaker's name is Rhodes Trussell, and he was the chairman of the National Research Council study called Understanding Water Reuse, the potential for expanding the nation's water supply through the reuse of municipal wastewater. And we'll provide a link for you to that study. The report was principally sponsored by the US EPA, and the research committee was composed of scientists, industry, and policy specialists from across the country. It's a fascinating look at how the scientific community is addressing our critical water issues. It's particularly relevant to us in Santa Clara County, given that the Water District and the City of San Jose are partnering on a new advanced water purification center set to open in June. You'll be hearing more about that. But before we get to that, we'd like to introduce you to a new feature on The People Behind Your Water, a short introduction to one of the folks who are out there every day, making sure that we have protection from flooding, enough clean, safe drinking water, and healthy creeks and watersheds. This month we spotlight Theo Hipol.
My name is Theo Hipol, and I have been here 13 years. I actually lead the SMP program, or the stream maintenance program, for the Coyote Pajaro Watershed Program Support Unit. There's also East, West, and Guadalupe Watershed, different section, but with a different set of engineers and staff. And we work together to share ideas on what we did at whatever creek facilities we've gone to. The stream maintenance program is actually a program that was set up to basically help maintain the creeks through sediment removal or bank repair jobs for areas of the creek that have eroded, to allow the creeks to continue to flow the way they're supposed to. Mainly for obviously for the public, since the creeks and a lot of our water facilities do flow through a lot of urbanized areas, especially now since there's a lot of development occurring. This season actually I think went real well. When the rain events come, that's when we get the real test. But I am anxious to see how they all actually perform. But in terms of all the projects, we were able to finish them on time, and they came out as beautiful as I imagined them and wanted them to come out. For this season, in terms of cubic yards of sediment removed, I believe it was anywhere between 20 to 30,000 cubic yards, probably over 200 truckloads. There was one large project. It was a sediment removal project, which was actually for Lower Silver Creek, both upstream and downstream Tully Road. It also involved working closely with the regulatory agencies, which that's where the environmental issues come in, and it's always good to work with them and see what we can and can't do, and in the end, when we make it work, we know we did something right. I like the work that I do. There's always a new project. When you have new projects, nothing ever gets boring. And with all the new regulatory, regulations and environmental issues we deal with, it keeps you on your toes, and that's what keeps me interested. I personally like to be outside, so to be out there in nature and be able to see these projects and how I can impact it and just be outside and not get locked up in an office all the time, it's fun for me.
Okay, so the charge to our committee had 6 elements. We were asked about the degree to which expanded water reuse could contribute to the national resource. This is an important question. We were asked to assess the state of the technology for the wastewater treatment. We were asked to look at the risks to human health and the risks to the environment. We were asked to look about monitoring and control systems and regulatory frameworks and their ability to assure safety and reliability. We were asked to look at the costs and benefits of reuse. We were asked to examine the barriers to implementation to reuse. And finally, we were asked to identify the research needs and to comment on the appropriate role of federal government. We were just thankful they didn't ask any more. Here, a little bit about the study process itself. We had 8 meetings in 5 states and Washington, D.C. over a 3-year period. We got input from numerous projects throughout the United States and overseas as well. We talked to people from Singapore, we talked to people from Europe, we talked to people from Australia. We conducted a survey of utilities, collected information on costs and operations. And in terms of the process of the National Academies, this is what I call the whole enchilada. This is a full peer-reviewed consensus report. So let's get on with the first chart. The potential for reuse of those wastewater is a potential resource for the nation. We reviewed recent data on the nation's recent water resources, and we concluded that both new water supplies and improved efficiency in the use of existing water supplies were required to meet the demands of growing populations and a changing climate. That's a loaded, complicated statement, but we're talking about the fact that we have not developed significant water resources in the United States since 1980. Population continues to grow. Our projections show that growth will continue. That at least the Consensus Bureau says so. The population is moving not from the southwest where it's dry to the northeast where it's wet, just the opposite. And global warming is reducing the rainfall in the southwest more than it is in the northeast. So everything is against us on those things. So all those things are the context in which we look at this question. As of 2008, the U.S. produced 32 billion gallons of wastewater effluent, and only 5 to 6% of that was reused. On the other hand, 12 billion gallons of that 32 billion gallons of wastewater each day is discharged to the ocean or to estuaries. So that represents 27% of the water used by the nation's municipalities nationally. So we concluded that we could say that the reuse of those wastewater does offer significant potential to increase the nation's water resource. So this is an important question. The remaining 20 billion gallons out of that 32 billion gallons a day, 62% of it is discharged inland. Assessing the potential for reuse of that water is a much more complicated question. I'll have some more comments on that later, but it's not as simple as the water being discharged in the ocean. Non-potable reuse is well established and generally well accepted. At the present time, potable reuse projects represent only a fraction of our reuse total. But de facto reuse is common. De facto reuse is a term our committee chose to use to describe reuse, which is practiced but not officially recognized or permitted as a reuse project. This is an illustration on this slide of the many circumstances throughout the nation where wastewater treatment plants with established NPDES permits discharge into streams or reservoirs, which then serve as a resource, as a source of water supply to drinking water systems downstream. While it's difficult to estimate the total contribution of this de facto reuse to the nation's total water supply, we know it's prevalent. Recent monitoring has documented the presence of wastewater-derived contaminants in the watershed throughout the country, including the State Water Project, as finished in court. The most recent effort we were able to find attempting to quantify the extent of de facto reuse throughout the United States was done in 1980. It was funded by the EPA 3 decades ago. It was a pretty crude effort. We only looked at about a third of the nation, maybe a little bit more. But we feel improved hydrologic data and better watershed models make it possible now to estimate the fraction of wastewater effluent in our surface waters under range conditions in a much better way than we would have. In today's world, the water treatment community has a broad portfolio of treatment options to address microbial and chemical contaminants in municipal wastewater. The illustration on the right, which I know you can't see very well, Figure 4.1, the committee's report, which tries to provide some perspective on that portfolio. I think it's in a little brochure you have. Okay, so this portfolio includes engineered physical, chemical, and biological systems, as well as natural systems. But the lack of clear guidance on the design and operation of natural systems is the biggest deterrent to expansion of meaningful use of those systems. And so we need research in that area. Also, with today's technology, we're not limited to one water quality for all uses. Some of our projects have demonstrated that very well. In fact, treatment can be tailored to meet the specific needs of almost any local application. And operations of West Basin, as I mentioned, are a good example. Membrane treatment processes are especially attractive for reuse, but these processes, particularly RO and NF, are not a panacea, as they have important sustainability issues, particularly in inland areas where the brine gets exposed to. The committee recommends that multiple barriers in reuse streams be designed to include both robustness and reliability. These are illustrated in a small chart on the right. Let me blow it up. So as shown on the right, each additional barrier provides additional removal of contaminants, improving reliability. So this is like the traditional definition of multiple barriers that you're probably accustomed to hearing in water treatment, where we provide filtration and disinfection to remove pathogens. As shown on the left, each additional barrier increases the variety of contaminants that the treatment system can remove, making the system more robust. So for example, you might have UV disinfection that removes cryptosporidium as well as chlorine, which will remove bacteria and viruses. Or you might have AOP to remove, UV and AOP to remove NDMA and 1,4-dioxin, as well as RO to remove bulk urine. Okay, reclamation facilities should also include monitoring and operation plans. It is the committee's opinion that as technologies for monitoring and attenuation or removal of contaminants improve, traditional requirements for retention time and blending will become less valuable. One important question is the role of environmental buffers. Natural systems are employed in most of today's global water reuse systems to provide an environmental buffer. Generally, these environmental buffers are included to provide retention time, additional attenuation of contaminants, and blending or dilution. But the committee felt that the science required to design for uniform protection from one environmental buffer to another is not available today. So a soil aquifer treatment system, surface water impoundment, riverbank system, each of these provides different levels of protection. In fact, from one project to another, protection provides different. Also, engineered processes can be designed to achieve these same functions, the question of retention time or attenuation, removal, and blending. So to put it another way, it cannot be demonstrated that such natural barriers provide public health protection that is not also available from engineered processes. So our committee concluded that potable reuse without an environmental buffer is worth considering, if adequate protection can be engineered into the system. Moreover, the committee also found that the distinction between indirect and direct potable reuse is not scientifically meaningful to product water quality. So we recommend that both practices be referred to as potable reuse. Health risks, as low as those that occur in a well-executed reuse project, cannot be adequately quantified through either epidemiology or toxicology. Epidemiology is just not sensitive enough. We had trouble proving to each other that smoking was important. And toxicology is just too early in its development. However, well-established established methods exist for estimating risk for both chemical and microbial contaminants and water reuse applications. So the message is, the occurrence of contaminant at a detectable level does not establish that the presence of that contaminant at that level presents a significant human health risk, but risk assessment methods are available which can be used to estimate human health effects where our epidemiological and toxicological tools are too coarse to make meaningful measurements. The committee also looked at evaluating risks in context. So, how can the leadership and local community get meaningful perspective on the risk of reuse and a reuse alternative being proposed for their community, particularly a potable reuse project? After examining past efforts by the national academies and by others to understand risks associated with potable reuse, the committee decided that it is appropriate to compare the risk from the water produced by potable reuse projects with the risk associated with water supplies that are presently in use. Specifically, with the risk associated with the de facto scenarios that are represented with so many drinking water supplies in our nation today, like the water supply where I live in Pasadena, like the water here in the South Bay Aqueduct, and like the water in the San Luis Reservoir. In order to examine this approach, the committee chose to construct a risk exemplar. The exemplar included a comprehensive analysis of 3 scenarios: 1 typical de facto reuse scenario and 2 typical potable reuse projects. To do the risk estimates, what we did is we used chemical risk assessment methods developed by the Academy in the 80s and refined again just recently. And we used quantitative microbial risk assessment methods developed by Professor Haas and Joan Rhodes and others that are experts in the microbial business that were used by EPA in the surface water treatment rule and also been used by the FDA in trying to understand the risk of eating chicken with salmonella and things like that. In choosing the contaminants to examine in the exemplar, the committee considered a broad cross-section of common pathogenic bacteria, viruses, and protozoa, as well as regulated and non-regulated chemicals that have been reported in reclaimed water or in surface water that receive wastewater discharges. The contaminants that are ultimately selected met 2 principal criteria. First, sufficient information was available on their occurrence, health effects, fate, transport, and behavior, so we could say anything about what would happen. And they are either recognized to be of concern for possible health effects or they are of interest to the public. As you can see, we ended up with 4 pathogens, 11 disinfection byproducts, 9 hormones and pharmaceutical compounds, and 4 additional chemicals. So these are the results of the exemplar for the pathogens. The results for the pathogens are best displayed. Well, first of all, we're talking here about risk of gastroenteric illness from 4 specific pathogens, and the risk here is demonstrated relative to the de facto supply. So these data are most, these data obviously are most effectively displayed in a relative way. So that's what we have here. We have relative risk of, I think it's 1 in a billion or 1 in a million or something, up to 1 to 1. So obviously in the de facto supply it's all 1 to 1 because that's the standard, and then you have the other 2 scenarios. And the risk is from norovirus, which is the most common cause of gastroenteritis in this country today. Adenovirus, which is one of the ones that's most difficult to get rid of. Salmonella, which is the second most important cause of gastroenteritis in the U.S. today. And cryptosporidium, another one that's very difficult to get rid of. All these risks have been normalized, as I said, in scenario 1. If you look at it, scenario 2 and 3 both have reduced risk, especially where viruses and bacteria are concerned in the SAT supply, and where all the pathogens are concerned with the MFRO UV supply. But in all cases, they're superior to the de facto alternative. Because of the tools employed, the risk from the chemicals are displayed in a different way. Here we have the results for these 24 organic compounds, and they are displayed as a margin of safety above some baseline level. We call it risk-based action level, which for the chemical, if it was regulated, was the MCL. If it was unregulated, it was some de minimis level. The scale on the left there goes from 0.1 to 1 billion on top. And the margin of safety of lower than 1 would be cause for concern. Margins of safety greater than 1 would reflect a no cause for concern. The chemicals are displayed in 3 groups: disinfectants and byproducts on the left, pharmaceuticals and hormones in the middle, and others on the right. So what we end up with is none of the 24 chemicals that were selected for this exemplar presents a health concern in any of the scenarios studied. The results suggest with appropriate treatment, potable use systems can provide protection from trace organic chemicals comparable to that the public experiences in many of today's public drinking water supply. And where pathogens are concerned, although there is some uncertainty, the exemplar results suggest that the risk from potable use is not any higher, and may be significantly lower than the risk experienced in many of today's current drinking water systems. So the committee also looked at costs. I'll touch on some of these things very briefly. 2 principal conclusions were drawn here. The first is that the financial costs of water reuse vary widely and are dependent on site-specific factors. So you get into this thing that Minutia was talking about, we're trying to understand the impact of the distribution systems. Well, it depends where you are, right? If you're doing it in downtown San Francisco, you've got a real serious go down Wilshire Boulevard, you have a huge cost. If you have a new community you're building out in the Central Valley and you're putting parallel pipes, it still costs serious money, but it's much more affordable. And the other conclusion was that the cost of the distribution system is often a very significant issue. Second conclusion that we had on non-monetized was that we should be looking at non-monetized costs also. And just a couple of examples of what those might be. Benefits you might consider would be the additional reliability, not being dependent on imported supplies. Examples of non-monetized costs might be a larger carbon energy footprint if you had a process with UV, AOP, and RO. And reduce floating downstream users if you had a situation where you were already discharging this to a stream and you were taking it out in order to reuse it. And that's why in inland situations it's not so straightforward. The committee also examined social, legal, and regulatory issues. First, the water rights laws, which vary from state to state, one state to the next, affect the ability of water authorities to reuse wastewater. It's not so complicated here in California, but I think it's interesting for Californians to learn about it. At least it was for me. Many of you probably are already there. But in general, the owner of a wastewater facility has the ability to reuse the water without purchasing from somebody else. That's the way it is here. But let me give us some examples of where it's not quite that way. In Utah, the right to reuse the wastewater must be specified in your operator's permit. In New Mexico, the operator's right to wastewater is dependent on his consumptive rights. In Colorado, the operator only owns the wastewater when the water upstream, in the distribution system, drinking water system, was developed water brought in from another basin. But if it was in the existing stream, then you don't have rights. The people downstream do. Those are just some interesting examples. We also looked at public attitudes and concluded that enhancing public knowledge of water supply and treatment is important in informed decision making. The public, decision makers, and the media need access to credible scientific and technical materials on water reuse to help them evaluate proposals and frame the issues. Also, we think there's room for optimism. Public debate on water reuse is evolving and maturing as more projects are moving. The committee also concluded that risk-based federal regulations for non-potable reuse would provide standards of public health protection that are uniform nationwide. For example, it could be argued that a head of lettuce grown on recycled water in Arizona ought to be at the same protection as a head of lettuce grown on recycled water in California. Modifications to the Safe Drinking Water Act could also serve to increase confidence. But where potable use is concerned, the committee also felt that a lot can be done without modifications to the Clean Water Act and the Safe Drinking Water Act, but using them as they exist today, but approaching the regulation a little bit differently, or enforcing the regulation a little bit differently. For example, Clean Water Act regulations could do a better job of recognizing the impact of wastewater discharges on drinking water as a beneficial use. That is done some here in California, it's not done in most states. Safe Drinking Water Act regulations could be better designed to address the circumstances of de facto reuse rather than just kind of pretending it's not happening. Such regulations could enhance public health protection and improve nationwide consistency of drinking water regulation. Another example, we are prior to pollutants. You know, we monitor and carefully regulate the prior pollutants in wastewater. Huge improvements, if you haven't seen the data, you should, have been made as a result of those regulations on metals in our drinking water and a number of specific toxins. But that list, even though it's technically revised every 5 years, that list is the same today as it was in the lawsuit in 1977. And if you know anything about the chemical field, you know that there's probably not, 99 out of 100 chemicals today weren't around. Although the ones that are on the list are still important. So we also looked at research needs. I don't want to go through each of these research needs one by one with you today. But let me just say we came up with 7 dealing with health, social, and environmental issues. And we also came up with 7 additional research needs in treatment efficiency and quality assurance. So let me just give you our bottom line summary in 4 statements. First, expanding water reuse could significantly increase the nation's water resource, particularly in coastal communities. Available treatment technology can reduce chemical and microbial contaminants to levels comparable to or lower than those present in many current drinking water supplies. Modifications to the Clean Water Act and Safe Drinking Water Act could ensure public health protection for both reuse projects and de facto reuse while increasing public confidence. And improved coordination among federal and non-federal entities could more effectively address the key research needs of reuse. Thank you very much.
Thank you again for joining us. We hope to see you again on The People Behind Your Water.